Welcome back to Revolutionary Health, the show that focuses on Black gay men's health and wellness. I'm Michael Ward. Make sure, as always, that you like, subscribe, follow, tweet all of our social medias on Facebook and Instagram. We're at The Counter Narrative. At Twitter, we're at Building Desire. This week, we'll be continuing our COVID-19 series. As we did with the Doctors Roundtable, we're going to continue with health professionals. We really wanted to get a perspective from nurses that are on the front lines of the COVID-19 era right now. So joining me this week, I have none other than the best person to talk to about this, Dr. Fields. I'll read a little bit about your bio. I know we normally just say introduce yourself, but it's such a comprehensive bio that I just want to clue the people in on the great person that we have on the show with us this time. And Dr. Fields is a lifetime NBA member, the founding president of the Greater New York City BNA chapter. He's a current NBA board of director and the NBNA Health Policy Committee chair with over 29 years of experience in the health sector as an educator, a researcher, clinician, administrator, consultant, health policy specialist, and entrepreneur business owner. So definitely the right person to talk to us about this topic. I just want to lead in a little bit with how are you feeling? How are you doing as you join us with the show?
So I'm really happy to be here to shine a light on the issue of nurses in the triumphant job that they've been doing. And we're going to talk about some of the challenges and what needs to be done and how people can support nurses that are really the lifeline in the healthcare infrastructure, being the largest component of our healthcare workforce. You know, I've been a nurse for almost 30 years, and I've never seen anything like this particular crisis that has really pushed our resources. So I'm really happy that we can talk about them in particular, and I'm happy to be here. Thank you for the opportunity.
Definitely, Dr. Fields. We're happy to have you here as well, too, to lead this discussion as far as the heroes that are on the front line with nurses. So I just kind of want to begin a little bit with the town hall that I saw that you all had as far as with Black nurses. Can you tell us a little bit about the town hall, what you all discussed, the issues that are facing nurses right now?
The Greater New York City chapter of the National Black Nurses Association is at the epicenter of what's going on, being that the pandemic is so focused in New York City. In that particular chapter, its members work all throughout the boroughs and throughout various healthcare systems. And we were hearing from our members at the time about the various challenges that they were having. So we convened a series of town halls, virtual town halls, to give voice to these nurses. And we've had two of them so far. The first one was just sort of a general, what's going on, tell us about what you're seeing in the facilities, because people really needed to vent, they needed to share. There's a lot of stress going on amongst the nurses, and they needed an outlet. And that was in early April when we had the first one. The second town hall was just this past Wednesday, and we did the same thing. People were telling their stories, their testimonials of actually being on the front lines, fighting against COVID-19. And we also invited some of our elected officials to talk with us. And it takes, I think it spoke very well for our elected officials that took their time to come and speak to some of the issues and really let the nurses know that they were hearing them. I am the health policy chair for the National Black Nurses Association, and I help to organize our National Day on the Hill in Washington, D.C., which is in February, Black History Month, where we go and we speak to our legislators. So, and I'm a Robert Wood Johnson Health Policy Fellow. I worked for Senator Barbara Mikulski during the time of the passage of the Affordable Care Act. So I have a large background in health policy. So one of my colleagues asked, it's like, how did you get elected officials to come speak with you? I was like, they realized they needed to come talk to the nurses because they were really surprised that our senior senator here in New York, Senator Charles Schumer, was actually on the call. They were like, how did you get him on? Well, you invited him. One other really important voice was Representative Lauren Underwood. She represents Illinois' 14th district. And someone's like, well, why would you invite a politician from Illinois? Well, Lauren Underwood is a nurse. She's an African American nurse, the youngest African American ever elected to Congress, the second Black nurse in Congress, and her whole agenda is healthcare. So it was really important that Lauren Underwood came and spoke to the town hall meeting as well to give us an update about what is being done to push federal legislation and laws to really help support our nursing workforce. So we had those were great outlets. And it's only part of the work that we're doing with the National Black Nurses Association. And I'll talk a little bit more about that. But those particular town halls are really important. And we are going to have a part 3 to voices from the front lines that we will also put on sort of mid-May. And we'll invite you to come and hear that one as well.
Definitely. Because I think as well with these town halls that they are highlighting a lot of the challenges, which you'll discussing things that are facing nurses, and as well the bigger picture of COVID-19 definitely affecting Black people at alarming numbers. So within these town halls, and as you are proceeding with your day-to-day with some of those challenges, like nurses not having adequate protective equipment or mental health services, all of those things, what can you tell me about those kind of challenges and maybe some of the solutions and resources that you all have?
Yeah, so let's review some of the challenges, and I wrote down an entire list.
I'm here for it. Come on, let's go.
Let's start with work with nurses at the beginning of the epidemic, the pandemic, not having the appropriate or the proper personal protective equipment, or what we call the PPE. And people need to understand, we're talking about the masks, the gloves, the face shields, the goggles, those things that the nurses really needed to protect themselves. And a lot of nurses at the beginning didn't have the proper equipment. So they were getting exposed, they were getting sick, they were dying. And that became a really big issue. Nurses are being overworked. They're working long hours and not being able to go home after for fear of infecting their family. So the inappropriate work assignments. A lot of people think that a nurse is a nurse is a nurse. Well, a lot of the care that the COVID-19 patients are requiring is what we call ICU level care. That's intensive care nursing, and it is a specialty. You have to be trained to provide that level of care. And not all nurses are ICU nurses. So we're hearing stories of nurses being pulled from, like a maternal ward that was shut down because people, aren't necessarily coming to the hospital for like elective surgeries and things like that. So nurses are being inappropriately reassigned. And that's causing a lot of stress. I'll give you a good example. There's a whole bunch of folks that we call advanced practice nurses. I'm a family nurse practitioner. So I haven't worked in a hospital in years. And one of my colleagues, who's also a family nurse practitioner in New York City, is working for one of the big hospital systems in an outpatient setting. And, he works in GI and he does, diabetes care. So they closed down his clinic and the hospital system said, okay, well, we're going to redeploy you back into the hospital system. And they gave him a 4-hour training and they expected him to go and cover the neonatal intensive care unit. That's caring for the sickest of the sickest of infants and babies. And he refused the assignment because he felt he wasn't properly trained. And he was right. And he was threatened to be fired for that. So that's the other thing that's happening. Nurses are being furloughed and they're being laid off inappropriately. So no nurse should have to worry about whether or not their job is in jeopardy, or because when they come back from being sick, 14 days of being quarantined, after not having the ability to get tested themselves, you hear a lot about the lack of testing. Well, we weren't even testing our healthcare providers who were on the front lines. So the nurses weren't getting access to test themselves. And these are people who knew they were exposed. So when they finally get tested, they go out, and they're being forced to come back, and immediately after 14 days, well, some of them are not ready to come back, but they're not being guaranteed their jobs. And being seen as a hero and being seen also as a potential vector at the same time is confusing to some people. There's lots of talk about, and praise and, clanging of pots to celebrate nurses, but that's only one side of it. There's also a lot of people who are fearing nurses because now, oh my God, I don't want to be around you because you're working with those patients. And, that was a very similar thing if you harken back to, when we were taking care of HIV patients in the early days, and potentially, being socially ostracized for working with those patients. So you hear some of that rhetoric come back up again. Then I want to be really clear about one thing. Our nurses are dealing with an overwhelming amount of death, and patients are dying, and these nurses are the only people at these people's bedsides. So they're having to be their surrogate family while, and all of us who are nurses have had patients die. I'm not saying that that's particularly unusual. What I'm saying is the volume in which patients are dying, the rate at which they were dying is really overwhelming. And the nurses are the ones that are being there to witness these patients as they take their last breaths. And this is leaving emotional scars and leaving the nurses traumatized. The nurses need mental health care themselves. Who takes care of the caretaker? And those services aren't being offered the way in which they need to be everywhere that they need to be. Now, the last thing, one of the things is a lot of the nurses also are really fearful because they still have their families to take care of. None of the other things in their lives really stopped. A lot of them also have kids that are now home. So how do you balance your family life with your work life that is ratcheted up to the point where, you really are burning this candle at two ends? And then I'll say just one more thing in particular, and that is to the nurses in the Black and Latino communities and nurses that are Black and Latino themselves. There's an extra burden. Nurses are the most trusted healthcare workers that we have. And a lot of us are the surrogate healthcare providers for our entire family. Sometimes we're the only healthcare provider in our family. So we're having to answer a lot of questions from fearful relatives, community members, taking care of the community, trying to, also provide that care for that elderly person in your community that need it. So it never stops. It really never stops. And it's starting to burn out a great number of people. So those are all of the challenges. Now, what can we do?
Yes.
First and foremost, federal legislators need to, in the next round of COVID-19 funding, provide for a means of hazard pay for nurses on the front lines. These nurses should be compensated appropriately. And it's not being done consistently across the country. We must absolutely ensure that all nurses have the appropriate access to PPE. No nurse should be forced to work without the appropriate attire. We need to ensure that all healthcare institutions that take federal funds through the CARES Recovery Act and any other federal program not be allowed to furlough or lay nurses off. They should not be able to double dip. Those are our tax dollars. And we still need to have an appropriate healthcare infrastructure. And key to that, the foundation to that, are the 4 million plus nurses in this country. That if if they were to walk out of every healthcare facility in our country for 10 minutes, the system would collapse
Wow.
completely. Completely. So they shouldn't have to worry about their jobs. We should extend sick leave and provide mental health services for all nurses without them having to go into their own pockets to do so. A lot of that mental health work can be done, like in forums like this. It can be done virtually, in private, where nurses can just have a place to vent. There are a lot of mental health care providers who can help us do that work. Finally, we need to donate directly to organizations that are directly supporting nurses. There's a lot of organizations out there collecting money, supposedly, to help with the efforts. But there's some financial insecurity that nurses are having, and organizations like the National Black Nursing Association. So I encourage, people to go to our website at nbna.org or directly to the website for the Greater New York City chapter of the Black Nurses Association, which is gnycbna.org. And on both of those sites, you'll see a donation button. We will get those funds directly, without any middleman, to nurses working on the front line. And those are the things that we can done specifically for nurses. The things that we can do generally, that everybody can do, because if we do this, we make the jobs of nurses easier. And if you have the ability to stay at home and continue the social distancing and the physical distancing that has been recommended, listen to the scientists and the other healthcare professionals. But people have to really take and think, what is going to be in the best interest of themselves and others. When you're out in public, start to wear your face coverings, because it really is about, trying to do as much as we can to stop the continued spread. Wash your hands, use hand sanitizer, and finally, be your brother's keeper. We have to do a lot to help ourselves. If people are looking to our federal government for the savior and help, and it's not coming, we have learned as Black people, as gay people, we got to help ourselves, and we're used to doing that. So help yourselves, help your brothers. Everybody knows somebody who is probably suffering in one way or another. And for those of us who have, we need to be more diligent about being able to prepare and offer. And the last thing I will say, in November, vote like your life depends on it, because it literally does.
Because it does. Yeah.
Yes.
Yes, definitely. I thank you so much for giving us those challenges, for laying it out beautifully, as well as resources and ways that we can help you and other nurses that are out there, because I think it's very important, as we said, continuing off the doctors roundtable, that we bring you in as well with nurses. As you say, if they step away for 10 minutes, everything will collapse. So I think that's very important, as well, like you say, of giving us those resources to donate to people directly, because a lot of it is, unfortunately, having to save ourselves with broken systems and politicians. So I think, as you said, as we started the video, it was a perfect forum in these town halls to bring in elected officials, know who your elected officials are, even if they aren't in your city, your state, any of those things, but have the experience, the breadth of knowledge, all of those ways. And especially while we're at home and you've got time to attend virtual town halls, to attend any of these forums, or send your senators messages, all of these things to make sure that you stay active as well. But I definitely want to continue this conversation. I know we're getting the side here as well. Just want to say, is there any last thoughts, any feelings, anything that you want to leave with everyone?
I just really want to say, everyone, do what you can to protect yourself. If you know a nurse personally, thank them. They don't hear it enough. Support them in any way that you can, particularly the Black and Latino nurses, because they're getting it doubly, not only at work but in the communities where they live, work, and play, that are also disproportionately impacted. Um, we got to make sure that we're supporting them. And thank you for the opportunity to talk about nurses. As a Black male nurse, and someone called me a unicorn. We really are a minority within our profession. And 2020, the World Health Organization declared this year the International Year of the Nurse and Nurse Midwife. And May 6th, this coming week, is National Nurses Day. So there'll be a lot of stuff online and virtually to celebrate nurses on that day. The National Black Nurses Association will be putting out some stuff as well. So this is National Nurses Week coming up. So this was perfect, absolute perfect timing.
Absolute perfect timing. And the perfect
Yes.
person for the show as well. So thank you again, Dr. Fields.
Absolutely. Thank you. I
chatting
really
with us.
appreciate it.
You're welcome. And thank you as well for everyone for watching another episode of Revolutionary Health. Make sure you like, subscribe, follow, tell a friend, tell a friend, tell a friend. We're on Facebook and Instagram at The Counter Narrative. Twitter, we're on Building Desire. Leave your comments, your suggestions, any people that you know as well that are in the healthcare industry, ways that we can support so that we can spread this love around. And as always, be good to yourself and take care and wash your hands. Bye, y'all.